So in this lesson, we're going to be talking about angina and what caring for this patient really looks like for you as the nurse. So angina is chest pain associated with a lack of flow to the heart muscle, okay? So lack of blood flow to the heart. This can be caused by things like coronary artery disease, stress, even things like anemia, or heart failure or arrhythmias, really anything that puts stress on the heart and can cause those blood vessels to clamp down or put a clot in them. So anything that decreases flow. So whatever the cause is, the number one goal is going to be to restore that flow. Now, it often presents as this mid-sternal chest pain, and it's usually like crushing or pressure. And sometimes it'll radiate to the arms or the jaw, usually the left side, but some people can also have radiation to the right as well. Now, angina is classified in 3 different ways. That's stable, unstable, and variant. Make sure you refer to the cheat sheet attached to this lesson to get lots of details about those 3 types. But I want to talk specifically about what nursing actions are required for a patient with unstable angina. In other words, if you're a nurse working on the floor and your patient complains of chest pain, what the heck do you do? So let's say you have a patient who begins to complain of chest pain. And in this hypothetical situation, they've never complained of this before. They don't already have any orders or anything. So what do we do first? Well, we always start with the nursing process. Assess, diagnose, plan, implement, evaluate. So if all you know at this point is that they're complaining of chest pain, we need more assessment information, don't we? First, we need to know more about the pain itself. Now, we can use whatever mnemonic works for you. You can use PQRST or you can use old carts. I personally like old carts, so that's what we're going to use. So we need to ask them when the pain started. That's your onset. O, onset. When did it start? L stands for location. So location is where is it? So let's say they say it's their chest, right on their sternum, okay? Durations, how long has it been going on? Let's say this has been going on for about 2 hours. C is character, so that's what does it feel like? So they're going to tell you that this is pressure or that it is crushing. Some of them might even tell you they have an elephant on their chest. I've heard some really creative things. A is aggravating or alleviating factors. So does anything make it worse or does anything make it better? So we're going to say nothing makes it better and nothing makes it worse. It's just constant. R stands for radiation. So is the pain moving anywhere? So let's say they're going to tell you that the pain is moving to their left arm and their jaw feels a little tight. T stands for timing. So that usually what we mean is, does it relate to anything? So is it like worse in the morning? Is it worse after you eat? Or is it just constant? And he's going to tell you this has been constant. And then S stands for severity. So this is when you ask, can you rate your pain on a scale of 0 to 10, 10 being the worst? And he's going to tell you it is a 10 out of 10. It's the worst thing I've ever felt in my life. Okay. So once we have all this information, we can possibly rule out other things. So if the patient told you it was sharp, that it was worse with breathing and it was worse in the morning, but it was intermittent, it came and went, then we're probably looking at something that has more to do with maybe a heartburn or some sort of respiratory issue or abdominal versus this angina that has to do with cardiac, okay? So at this point, we also need to get a set of vital signs. That's part of our assessment. Specifically, we want to get blood pressure, heart rate, and pulse oximetry or SpO2. It's going to give us lots of information. If your patient's on a monitored unit, you could also put them on a 3-lead or a 5-lead EKG if you want. You can immediately see if there's any arrhythmias just by putting them on that quick monitor, okay? No, so let's say here's your information. So your patient's blood pressure is 103/67, their heart rate is 142, and their SATs are 93%. Okay, so now I've done my assessment. Do I have enough information to move on from assessment in my nursing process? Yeah, I think I do. So I can diagnose that there's some sort of perfusion or maybe oxygenation problem because we know we've got chest pain and his heart rate's a little bit high, his oxygen's a little bit low for, lower than normal. And so we know there's some sort of problem, right? So next steps our plan and implement. So what are the main interventions for angina, and at what point do you need to call the doctor? So the mnemonic that we use is MONA. Okay, MONA, this is the most common interventions for angina and chest pain. This stands for morphine, oxygen, nitrates, and aspirin. Okay. Now, this is not the order that we give them in. It's just the way to remember them. So of those 4 interventions, which one can you do without having to call the doctor first? Bam, oxygen. So you can immediately put this patient on 2 liters of O2 via nasal cannula because the sats were a little bit low. That's something that you can do as a nursing intervention before you call the provider. Okay. So we've done that. We've called the doctor. What other interventions are we going to anticipate? Again, anticipation is part of your planning stage, right? What do we expect the doctor to order? So medication-wise, we always start with nitroglycerin. This is our first med because it helps to relieve the pain if it's that cardiac pain, because it's a vasodilator. So it's going to get into those coronary arteries and it's going to open them up and help bring that flow back. So we always want to give that first. We can expect the doctor to order a 12 lead EKG so we can see if there's a myocardial infarction going on. And we can also expect cardiac enzymes so that we can see if there's any damage to that heart muscle. So we'll get an order also for aspirin. We usually give 324. That's 4 baby aspirins. Then we'll also give this nitroglycerin. Again, this is 0.4 milligrams sublingual. Aspirins are usually chewable. And let's say we give this first dose of nitroglycerin and we wait 5 minutes and the patient's still in pain. So if we do that, we're going to give another dose. We're going to give our second dose. And at that point, go ahead and call the provider because clearly something's not going well. Clearly it's not really working like we expected it to, and we need to go ahead and initiate the process of getting them involved. Now, if the nitroglycerin still doesn't work after the 3rd dose, we're going to move to giving them morphine. Okay. Not only is the morphine going to help with the pain, but it can also help to decrease the workload of the heart. The problem here is though you want to give the nitroglycerin first because you need to know whether or not that's fixing the problem. If you give them morphine, you dull all of their pain senses and you'll never know whether or not this vasodilation actually helped. So start with nitro, and if it doesn't work, then you move to morphine. Okay. There we go. And again, it can also help to decrease the workload on the heart. So now we need to evaluate. Now, this is a step in the nursing process that a lot of people skip. So make sure you evaluate. So in the case of this patient, let's say the nitro did not work and the 12 lead EKG is showing that the patient is actually in supraventricular tachycardia or SVT with a rate of 164. So at this point, we have to treat the cause. Okay, so if we know that what the cause is or we can figure it out, we need to take care of it. So we'll notify the provider and we'll anticipate the move to some sort of cardioversion to address this SVT because that's probably what's causing it. So again, ultimately the goal with angina is to reverse the cause and to restore blood flow to the heart muscle. If we don't act quickly, angina can actually progress and become a myocardial infarction. So knowing what to do and in what order helps us be really proficient and efficient and get the patient the help they need quickly. Okay, so remember when a patient's having chest pain, a thorough pain assessment is going to get you the most information that you need and get a good picture of what's happening with your patient before you call the provider. Anticipate what they might order. They're going to order a 12 lead. They're probably going to order cardiac enzymes. And then as far as medications and interventions, we're looking at things like MONA. And we use morphine, oxygen, nitrates, and aspirin. Now, unstable angina is usually not responsive to the nitroglycerin. And so there's always something else going on. So we want to figure out what the cause is and take care of that. And as always, follow your nursing process. Assess, diagnose, plan, implement, evaluate. Trust your instincts. Be confident with which interventions need to happen first in order to get the best outcomes. So the scenario we just discussed is what I like to call an NCLEX world scenario. What that means is it was one where you could only do one intervention at a time and you couldn't multitask or have anyone else do anything for you, right? So in the real world, as soon as I think I have a significant angina issue, I'm asking the secretary or the charge nurse to call the doctor for me while I finish my assessment, apply oxygen. I've also likely asked somebody to grab lab tubes to draw cardiac enzymes, and maybe even called for the EKG tech or the EKG machine. Now, that's the beautiful thing about nursing and why we love it so much is we function as a team to get so many things done in a short period of time. Because in the end, we're all there for the best interest of the patient.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.